Dr. Smith's diaper ointment is used to treat and prevent diaper rash and other minor skin irritations, such as burns, cuts, and scrapes. It works by forming a barrier on the skin to protect it from irritants and moisture. It is recommended to apply a thick layer of the ointment to the affected area at each diaper change. This ointment is meant to be applied only on the skin. Make sure to follow the instructions on the product package or as directed by your doctor. If you have any questions, it's best to ask your doctor or pharmacist for clarification. Be careful to avoid getting this ointment in your eyes. If it does accidentally get in your eyes, be sure to rinse them out with plenty of water. If you're using the spray version of this medication, be sure to shake the container well before each use. You can expect this medication to start working within 12 hours. If your condition worsens, doesn't improve, lasts for more than 7 days, or occurs again after a few days, it's important to inform your doctor. If your doctor has prescribed this medication, it means that they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's important to inform your doctor immediately if you experience any serious side effects, such as skin irritation. Although rare, a severe allergic reaction may occur. Seek medical help if you notice symptoms like rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's best to consult your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you have any allergies, make sure to talk to your doctor or pharmacist before using this diaper ointment. This product may contain inactive ingredients that could cause allergic reactions. If you have a skin infection in the affected area, be sure to consult your doctor or pharmacist before using this product. If you are pregnant or breastfeeding, consult your doctor before using this medication. It is unknown if this drug passes into breast milk, so it's important to talk to your doctor before breastfeeding. Remember to always consult a healthcare professional before using any medication. When using Dr. Smith's diaper ointment, it's important to be aware of potential drug interactions that could affect the way your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this ointment is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the US, you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Make sure to keep all scheduled medical appointments and follow-up visits. To prevent diaper rash, it's important to check your baby's diaper frequently and change it as soon as it becomes wet or soiled. Dr. Smith's diaper ointment is used to treat and prevent diaper rash. It creates a protective barrier on the skin to soothe and heal irritated skin. It should be applied liberally at each diaper change, or as directed by a doctor. This ointment is best used at bedtime or any time when exposure to wet diapers may be prolonged. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep all medications out of reach of children and pets. Do not flush this product down the toilet or pour it into a drain unless you are instructed to do so. When it is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.